Alright, so today I'm going to be taking a look at acetaminophen. I don't ever really take Tylenol, Aleve, Advil, any of that, so I don't really know what ibuprofen, acetaminophen, and what's the other one? Nox, the one that's in Aleve. I don't understand what they do, if they can work together or what. So I'm going to take a personal dive and make videos out of it into each one. So we have acetaminophen. Am I even saying that right? I wonder if you could hear it if I do this.
Acetaminophen.
I can't even hear it. I don't have the volume on. Oh well. Generic name acetaminophen. Oral acetaminophen. Brand name Actamin. Blah blah blah. Tylenol. So it looks like it's basically Tylenol is the most famous one. All the rest, I don't know what they are. So what is it? It's a pain reliever and a fever reducer. Okay. It is used to treat mild to moderate and pain, to treat moderate to severe pain in conjunction with opiates, or to reduce fever. Common conditions that acetaminophen treat include headache, muscle aches, arthritis, backache, toothache, sore throat, colds, flu, and fevers. Yes, fever reducer and pain reliever, so that would make sense. Acetaminophen, sorry if I keep saying that wrong, is also available in many over-the-counter combination medications with other drugs, including Actifed, Alka-Seltzer Plus liquid gels, Cepacol, Contact, Dayquil. Most of these I haven't heard of. Excedrin, Feverol, Midol, NyQuil, etc. This product is also found in many prescription combination drugs, including Butylbitol, Endocet, Fioricet, Hysotab, Hydrocet, yada yada, Tylenol, Tylox, Vicodin, and Zydone. It is typically used orally but can be given intravenously. Warnings. You should not use this medication if you have severe liver disease. An overdose of this can damage your liver or cause death. Adults and teenagers who weigh at least 110 pounds should not take more than 1,000 milligrams, or basically 1 gram, at a time, or more than 4,000 milligrams, 4 grams, in 24 hours. Children younger than 12 years old should not take more than 5 doses in 24 hours, using only the number of milligrams per dose that is recommended for the child's weight and age. Use exactly as directed on the label. Avoid also using other medicines that contain this product, sometimes abbreviated as APAP, or you could have a fatal overdose. Call your doctor at once if you have nausea, pain in your upper stomach, itching, loss of appetite, dark urine, clay-colored stools, or jaundice. Stop taking this medicine and call your doctor right away if you have skin redness or a rash that spreads and causes blistering and peeling. Some ads. Before taking this medicine, you should know that if you are allergic to it or if you have severe liver disease, don't take this. Do not take this medicine without a doctor's advice if you have ever had alcoholic liver disease or if you drink more than 3 alcoholic beverages per day. You may not be able to take this medicine. Your doctor will determine whether this medicine is safe for you to use during pregnancy. Do not use this medicine without the advice of your doctor if you are pregnant. The reason for that is because this medicine can pass into breast milk, so you need to ask your doctor before using this medicine if you are breastfeeding. Do not give this medicine to a child younger than 2 years old without the advice from your doctor. Now, how should you take this? You should take it exactly as described on the label, or as prescribed by your doctor. Do not use in larger or smaller amounts or for longer than recommended. Do not take more of this medication than is recommended because an overdose of this product can damage your liver or cause death. Adults and teenagers who weigh at least 110 pounds or 50 kilograms do not take more than 1,000 milligrams or 1 gram at a time. Do not take more than 4,000 milligrams or 4 grams in 24 hours. I think we already read this actually. We're just restating it. If you are treating a child, use a pediatric form of acetaminophen. I screwed that up. Use only the special dose measuring dropper or oral syringe that comes with the specific pediatric form you are using. Carefully follow the dosing directions on the medicine label. Measure liquid medicine with this dosing syringe provided, or with a special dose measuring spoon or medicine cup. If you do not have a dose measuring device, ask your pharmacist for one. They do make this product for infants, and it's available in 2 different dose concentrations, each concentration with its own medicine dropper or oral syringe. These dosing devices are not equal between the different concentrations. Using the wrong device may cause you to give your child an overdose of this product. Never mix and match dosing devices between infant formulations of this product. You may need to shake the liquid before each use. Follow the directions on the medicine label. The chewable tablet must be chewed thoroughly before you swallow it. Make sure your hands are dry when handling this product. Disintegrating tablet. Place the tablet on your tongue. It will begin to dissolve right away. Do not swallow the tablet whole. Allow it to dissolve in your mouth without chewing. To use this product, effervescent granules, dissolve 1 packet of the granules in at least 4 ounces of water. Then you want to stir the mixture and drink all of it right away. To make sure you get the entire dose, add a little more water to the same glass. Stir it gently and drink right away. The oral powder should be placed directly on the tongue and swallowed. Stop taking this medicine and call your doctor if you still have a sore throat after 2 days of use, you still have a fever after 3 days of use, you still have pain after 7 days of use or 5 days of treating a child, you have a skin rash, ongoing headache, nausea, vomiting, or any redness or swelling, or if your symptoms get worse, or if you have any new symptoms. This medication can cause unusual results with certain lab tests for glucose, which is sugar, in the urine. Tell any doctor who treats you that you are using this product. Store at room temperature and away from heat and moisture. What happens if I miss a dose? Since it's mostly over the counter, I don't think it really matters. We'll skip that. What happens if I overdose? You need to seek emergency medical attention or call the poison hotline at 1-800-222-1222. An overdose of this can be fatal. The first signs of an acetaminophen overdose include loss of appetite, nausea, vomiting, stomach pain, swelling, and confusion or weakness. Later symptoms may include pain in your upper stomach, dark urine, and yellowing of your skin or the whites of your eyes. What to avoid? Ask a doctor or pharmacist before using any other cold, allergy, pain, or sleep medication. App is contained in many combination medicines. Taking certain products together can cause you to get too much of this product, which can lead to a fatal overdose. Check the label to see if a medicine contains app. Also, you want to avoid drinking alcohol, as this may increase your risk of liver damage while taking acetaminophen. Acetaminophen side effects. You're going to want to get emergency medical help if you have signs of an allergic reaction to this product. Signs of an allergic reaction include hives, difficulty breathing, swelling of your face, lips, tongues, or throat. In rare cases, this product may cause a severe skin rash that can be fatal. This could occur even if you have taken this medicine in the past and had no reaction. Stop taking this medicine and call your doctor right away if you have skin redness or a rash that spreads and causes blistering and peeling. If you have this type of reaction, you should never again take any medicine that contains this product. Stop taking this product and call your doctor at once if you have nausea, upper stomach pain, itching, or loss of appetite. If you have excessive sweating and severe tiredness. If you have dark urine or clay-colored stools, or if you start becoming jaundice. The most common side effects of this product include nausea and vomiting, headache, and or insomnia. This is not a complete list of the side effects that may occur. Call your doctor for medical advice about side effects. What other drugs will affect this product? Other drugs may interact with this product, including prescription and over-the-counter medicines, vitamins, and herbal products. Tell each of your healthcare providers about all medicines you use now and any medicine you start or stop using. Now I'm continuing and I'm going to look at ibuprofen. Ibuprofen is Advil, Motrin. That's about all. That's the only brands I know that they show. Let's get into it. So what is ibuprofen? It's a non-steroidal anti-inflammatory drug, NSAID. Well, that's kind of handy right there because I keep seeing NSAID on the bottles, and I'm not sure what that actually means. So it's non-steroidal anti-inflammatory drug. So that's good. It works by reducing hormones that cause inflammation and pain in the body. Okay. Ibuprofen is used to reduce fever and treat pain or inflammation caused by many conditions such as headache, toothache, back pain, arthritis, menstrual cramps, or minor injury. Okay, I think the acetaminophen didn't have menstrual cramps or minor injury. It had the other things, but didn't have this. It also isn't an NSAID. So those are differences right off the bat. Ibuprofen is used in adults and children who are at least 6 months old. Warnings. Ibuprofen can increase your risk of fatal heart attack or stroke. Do not use this medicine just before or after heart bypass surgery. Ibuprofen may cause stomach or intestinal bleeding, which can be fatal. These conditions can occur without warning while you are using this medicine, especially in older adults. Do not take more than your recommended dose. An ibuprofen overdose can damage your stomach or intestines. Use only the smallest amount of medication needed to get relief from your pain, swelling, or fever. My only thing that I could think of with that is it says use the smallest amount of medication needed. So I don't know, say the dose is 2 pills. Are they saying just take the 2 pills and call it a day? Or are they saying try just 1 pill and take 2 pills as a max? That's something I've never understood. Like I said, I don't usually take stuff, so it's a legit question. I just don't understand. That's why I'm trying to learn. Anyway, before taking this medicine, you should not use ibuprofen if you are allergic to it, or if you have ever had an asthma attack or severe allergic reaction after taking aspirin or a different NSAID. Ask a doctor or pharmacist if this medicine is safe to use if you've ever had heart disease, high blood pressure, high cholesterol, diabetes, or if you smoke. Smoke? I didn't know smoking could have some kind of interaction with this. Well, actually, I should say I didn't know smoking would matter with any, like these over-the-counter type products. Acetaminophen, well, let's just say the brands Advil, Aleve, Tylenol. I didn't know. Anyhow, a heart attack, stroke, or blood clot, stomach ulcers or bleeding, that one would make sense because it says it can cause intestinal bleeding. So if you have ulcers or anything, chances are this could make it significantly worse. Liver or kidney disease, asthma, or if you take aspirin to prevent heart attack or stroke. Ask a doctor before using this medicine if you are pregnant or breastfeeding. If you are pregnant, you should not take ibuprofen unless your doctor tells you to. Taking an NSAID during the last 20 weeks of pregnancy can cause serious heart or kidney problems in the unborn baby and possible complications with your pregnancy. Wow. Never knew that before. Do not give ibuprofen to a child younger than 6 months old without the advice of a doctor. How should I take ibuprofen? Use ibuprofen exactly as directed on the label, or as prescribed by your doctor. Use the lowest dose that is effective in treating your condition. An ibuprofen overdose can damage your stomach or intestines. The maximum amount of ibuprofen for adults is 800 milligrams per dose, or 3,200 milligrams per day, 4 maximum doses. 8 times 4, 32. So they're telling you that the 32 is absolute max per day. A child's dose is based on the age and weight of the child. Carefully follow the dosing instructions provided with children's ibuprofen for the age and weight of your child. Ask a doctor or pharmacist if you have questions. Take ibuprofen with food or milk to lessen stomach upset. Again, that would make sense because it says that this product can cause intestinal bleeding and such. So if it's just going in there empty, then it's probably got a higher chance of messing with your intestines than if there's food floating around in there as well to kind of cause form a barrier. Although milk, I don't know about milk. I almost feel like milk might make you sicker. I mean, if you drink milk on an empty stomach, sometimes that can make you feel sick. Anyhow, shake the oral suspension liquid before you measure a dose. Use the dosing syringe provided, or use a medicine dose measuring device, not a kitchen spoon. You must chew the chewable tablet before you swallow it. You must store at room temperature and away from moisture and heat. Do not allow the liquid medicine to freeze. What happens if I miss a dose? Well, kind of like with acetaminophen, I don't think it really matters because this is mostly just pain reliever. What happens if I overdose? You're going to want to seek emergency medical attention and call the poison helpline at 1-800-222-2729. 1222. Overdose symptoms may include nausea, vomiting, stomach pain, drowsiness, black or bloody stools. Okay. Acetaminophen was clay-colored stools. These are black or bloody. Coughing up blood. Okay. Shallow breathing, fainting, or coma. Wow. Ibuprofen overdose sounds a lot worse than the Tylenol one. Coma? You could go into a coma? Jeez. What to avoid? Ask a doctor or pharmacist before using other medicines for pain, fever, swelling, or cold and flu symptoms. They may contain ingredients similar to ibuprofen, such as aspirin, ketoprofen, or naxaprin. Avoid taking aspirin unless your doctor tells you to. If you also take aspirin to prevent stroke or heart attack, taking ibuprofen can make aspirin less effective in protecting your heart and blood vessels. If you take both medicines, take ibuprofen at least 8 hours before or 30 minutes after you take aspirin, non-enteric coated form. That's kind of weird. Take ibuprofen at least 8 hours before you take aspirin or 30 minutes after? That's a weird window. Much like with Tylenol, avoid drinking alcohol, as this may increase your risk of stomach bleeding. Ibuprofen side effects. Get emergency medical help if you have signs of an allergic reaction to ibuprofen, which include hives, difficulty breathing, swelling in your face or throat, or if you have a severe skin reaction, such as a fever, sore throat, burning eyes, skin pain, red or purple skin rash with blistering and peeling. Get emergency medical help if you have signs of a heart attack or stroke, which include chest pain spreading to your jaw or shoulder, sudden numbness or weakness on one side of the body, slurred speech, leg swelling, or feeling short of breath. Stop using this medicine and call your doctor at once if you have changes in your vision, shortness of breath, even with mild exertion, swelling or rapid weight gain, a skin rash, no matter how mild, signs of stomach bleeding, which would be bloody or tarry stools, coughing up blood or vomit that looks like coffee grounds, liver problems. These would be nausea, upper stomach pain, itching, tired feeling, flu-like symptoms, loss of appetite, dark urine, clay-colored stools, or jaundice. If you end up having low red blood cells, anemia, this would make your skin be pale, you'd feel lightheaded or short of breath, you'd have a rapid heart rate, and you'd have trouble concentrating, or if you notice you're having kidney problems, which would include little to no urinating, painful or difficult urination, swelling in your feet or ankles, and or feeling tired and short of breath. Wow. A lot of these are short of breath. If you had anemia, kidney problems, and what was the other one? Oh, yeah, it was just mentioned up here, but 2 of them. Wow, I didn't know kidney problems would make you have short of breath. I understand the anemia, but kidney problems? Common ibuprofen side effects may include nausea, vomiting, or gas, bleeding, or dizziness and headache. Well, I guess you'd be lucky, I suppose you could say, if all you had was gas. I mean, compared to everything else, it's not that bad. This is not a complete list of the side effects, and others may occur. Call your doctor for medical advice about side effects. You may also report a side effect to the FDA. What other drugs will affect ibuprofen? Ask your doctor before using ibuprofen if you take an antidepressant. Taking certain antidepressants with an NSAID may cause you to bruise or bleed easily. Ask a doctor or pharmacist before using ibuprofen with any other medications, especially cyclosporine, lithium, methotrexate, a blood thinner, heart or blood pressure medication, including a diuretic or water pill, or steroid medicine, such as prednisone. And that looks like that's everything on ibuprofen. So, in comparison to the Tylenol one I did, it sounds like it offers more relief options. Like it said, mild injury and I think menstrual cramps, which the Tylenol, the acetaminophen, doesn't do. But it also sounds like there's a lot more brutal side effects, such as possible comas or bleeding, throwing up blood, or bloody stools. Ugh. Never realized ibuprofen was kind of threatening, if used wrong at least. So now we are looking at naproxen. What is naproxen? Naproxen is an NSAID, okay? It's just like ibuprofen is. It works by reducing the hormones that cause inflammation and pain in the body. Naproxen is used to treat pain or inflammation caused by conditions such as arthritis, ankylosing, I don't know what that is, I'm not going to try to say it, tendinitis, bursitis, gout, or menstrual cramps. It can also be used to treat acute pain caused by other conditions not listed in the medication guide. So this almost sounds like it's more for like joints based on tendinitis, gout, arthritis. The delayed release or extended release tablets are slower acting forms of naproxen that are used only for treating chronic conditions such as arthritis or that one. These forms will not work fast enough to treat acute pain. Yeah, so that's like for, just like a leaf says, all day long, all day strong. Now I get it, because it's slow release. So when you have arthritis, it goes all day. So then let's say your hands can function well enough for you throughout the day. Warnings. You should not use naproxen if you have a history of allergic reaction to aspirin or other NSAIDs. Naproxen can increase your risk of fatal heart attack or stroke, especially if you use it long-term or take high doses, or if you have heart disease. Even people without heart disease or risk factors could have a stroke or heart attack while taking this medicine. That's weird, because isn't Aleve the one that they... What's the one that they always said was... No, Bayer. What's the Bayer one? I don't know, I'm trying to think of the one that they say is good if you're having a heart attack, to pack down a couple of those and it's supposed to help you right away. Anyhow, do not use this medicine just before or after heart bypass surgery. Get emergency medical help if you have swelling of the face or throat, chest pain, weakness, shortness of breath, slurred speech, or problems with vision or balance. Stop taking naproxen and notify your physician if you notice stomach pain, tiredness or weakness, yellow skin or eyes, nausea, vomiting, bloody or black, and sticky bowel movements, skin rash, unexplained weight loss or weight gain, or swelling of the hands and feet. Naproxen may also cause stomach or intestinal bleeding, which can be fatal. These conditions can occur without warning while you are using this medicine, especially in older adults. Before taking the medicine, you should know that naproxen may also cause stomach or intestinal bleeding, which can be fatal. These conditions can occur without warning while you are... we just read that. You should not use naproxen if you are allergic to it, or if you have ever had an asthma attack or severe allergic reaction after taking aspirin or another NSAID. Ask a doctor before giving naproxen to a child younger than 12 years old. Ask a doctor or pharmacist if it is safe for you to use this medicine if you have heart disease, high blood pressure, high cholesterol, diabetes, or if you smoke. If you have a history of heart attack, stroke, or blood clot, if you have a history of stomach ulcers or bleeding, if you have asthma, if you have liver or kidney disease, if you have fluid retention issues, or if you take aspirin to prevent heart attack or stroke. If you are pregnant, you should not take naproxen unless your doctor tells you to. Taking an NSAID during the last 20 weeks of pregnancy can cause serious heart or kidney problems in the unborn baby and possible complications with your pregnancy. It may not be safe to breastfeed while using naproxen. Ask your doctor about any risk. Naproxen is not approved for use by anyone younger than 2 years old. Do not give this medicine to a child without medical advice. How should you take naproxen? Well, you should take it exactly as directed on the label, or as it is prescribed by your doctor. Do not take this medicine in larger amounts or for longer than recommended. Use the lowest dose that is effective in treating your condition, much like ibuprofen, because, well, they're both NSAIDs. Shake the oral suspension liquid well just before you measure a dose. Measure liquid medicine with the dosing syringe provided, or with a special dose measuring spoon or medicine cup. If you do not have a dose measuring device, ask your pharmacist for one. If you change brands, strengths, or forms of this medicine, your dosage needs may change. Ask your pharmacist if you have any questions about the kind of naproxen you are using. If a child is using this medicine, tell your doctor if the child has any changes in weight. Doses are based on weight in children, and any changes may affect your child's dose. If you use this medicine long term, you may need frequent medical tests. This medicine can cause unusual results with certain medical tests. Tell any doctor who treats you that you are using naproxen. You should also store this at room temperature away from moisture, heat, and light. Keep the bottle tightly closed when not in use. What happens if I miss a dose? The same as others. It doesn't really matter too much. What happens if you overdose? Call the poison line. What should you avoid? You should avoid drinking alcohol as it increases your risk of stomach bleeding. You should also avoid taking aspirin unless your doctor tells you to. Also, ask your doctor before taking any other medication for pain, arthritis, fever, or swelling. Many medicines available over the counter contain aspirin, salicylates, or other medicines similar to naproxen, such as ibuprofen or ketoprofen. Taking certain products together can cause you to get too much of this type of medication. Ask your doctor before using an antacid, and use only the type your doctor recommends. Some antacids can make it harder for your body to absorb naproxen. Naproxen side effects. Get emergency medical help if you have signs of an allergic reaction to naproxen, which would include wheezing or trouble breathing, hives, swelling of your face, lips, tongue, and/or throat. Get emergency medical help if you have signs of a heart attack or stroke. These include chest pain spreading to your jaw or shoulder, sudden numbness or weakness on one side of the body, slurred speech, or feeling short of breath. Stop using naproxen and call your doctor at once if you have shortness of breath, even with mild exertion, swelling, or rapid weight gain, the first sign of any skin rash, no matter how mild, signs of stomach bleeding, bloody or tarry stools, coughing up blood or vomit that looks like coffee grounds, liver problems, which would include nausea, upper stomach pain, itching, tired feeling, flu-like symptoms, loss of appetite, dark urine, clay-colored stools, or jaundice. If you have kidney problems, which would be little to no urinating, painful or difficult urination, swelling in your feet or ankles, or feeling tired or short of breath. If you are having anemia, which is low red blood cells, which would be pale skin, feeling lightheaded or short of breath, have a rapid heart rate or trouble concentrating, or a severe skin reaction, which could include fever, sore throat, swelling in your face or tongue, burning in your eyes, skin pain followed by a red or purple skin rash that spreads, especially in the face or upper body, and causes blistering and/or peeling. Common naproxen side effects may include indigestion, heartburn, stomach pain, nausea, headache, dizziness, drowsiness, bruising, itching, rash, swelling, or a ringing in your ears. What other drugs will affect naproxen? Well, you should ask your doctor before using naproxen if you take an antidepressant, such as citalopram or these other ones, Prozac, Zoloft, etc. Taking any of these medicines with an NSAID may cause you to bruise or bleed easily. Ask a doctor or pharmacist if it is safe for you to use this medicine if you are also using any of the following drugs. As you can see, the list is right here. Slow the video down and look through it. And that's all. So I guess so far what I'm gathering is the difference between basically Tylenol, acetaminophen, ibuprofen, and this one. What was this one called again? Naproxen, is that they seem to be gradually stronger as you go up. And naproxen, I think what I'm gathering is naproxen is the strongest, but it comes in like a slow release, so it has the potential to last all day. Where the other ones are kind of like, they blast out in you and then they last for, X amount of time. Where this one could last potentially all day. So anyhow, that's all we got for this one. And until next time, I hope you already know, I said see ya.